conversations amongst amongst all of us, really, probably either separately or together or, in different conversations. But essentially what we're proposing looks a little different than what this description was, so I apologize, it doesn't quite match. But what's come to light is that given that it's a one-day time frame, 10 a.m. to 5 p.m., what probably is most critical to do is to walk providers through, now that now you have your needs assessment data and you've selected a priority intervening variables, whatever they may be, whether it's 1 or 2 or whatever, it's how do you prioritize your intervening variables? Sorry. So the process of prioritization needs to be really important. And then, so this part here would significantly increase. It wouldn't just be 45 minutes.
Yeah.
And then I think this would go from like 10:30 to 12:30. Okay. And then you'll note that yes, you have to make the final decision. Well, you've already done that. So then it becomes, how do you select appropriate strategies? And this is content that I would pull primarily from the webinar that I did in April, and I'll show you those slides in a second. But so, you want to look at an effective strategy matrix, and that's something that I'm going to work on maybe tomorrow, if I'm lucky.
Can you remind me what the date is for this training? It's early January, isn't it?
January 9th and 11th.
Yeah, I wish it was a little later.
Right?
Yeah.
So let me show you. I'm glad this is on my screen. Let me show you the matrix that it would look different. But essentially, so we talk about how to prioritize, then we talk about how do you match up your priority intervening variables with strategies that actually could make an impact on those variables. Mm-hmm. And then we would talk about just because it makes an impact doesn't mean you should really do it, because you have to really think about conceptual fit. What else did I say in here? Conceptual fit, practical fit. And that's where I think that's the end of it. We really can't get into how to do work, how to actually do things. I think the purpose of this should be they need to prioritize, and then they need to have a brief introduction to the strategies that are acceptable, especially under environmental strategies. And then what we say at the end is we're going to do a series of however we determine, and this is again up for discussion. So we could do a series of webinars on evidence-informed prescription drug strategies. And this is where I think we've had discussions with you about it's really critical to think through best practice steps, for certain interventions, and that's where the work bundles come in. So I think we've all agreed, I think if my memory serves, that perhaps work bundles wouldn't be important until fiscal year 19. So, if I decide to do a permanent medication Dropbox thing, here's the 5 steps that we've all agreed upon on how to do it. Then I enter those 5 steps as work bundles, and I'm free to add additional steps as an example, but here's the 5 steps that the state is at a minimum saying is what constitutes how to do a permanent medication Dropbox or whatever. But anyway.
Do that, because that's a lot of work.
It is. It is. And that's why, well, some of the work has kind of been done, right? We took information from.
I don't like the work bundles as they are. They don't feel very informative to me. I hate to say that without the categories were too broad to be action steps, and they were generic, which I agree they need to be generic. I almost wonder if the work bundles almost need to be more generic than what they are, where providers can fill them in based upon the particular strategy. I don't think there's any way we're going to be able to have them for every intervention type.
And I'm trying to remember what the work bundles look like, so that's why forgive me as I get
them for a while, so my memory might be off base a little bit. Terry and I talked about this though, and we seem to see that they were not as informative as they could be. I think. Is that fair to say, Terry?
Well, I think that they were not going to be fitting for every strategy. I mean, they weren't going to work. You know, you don't need all that for information dissemination, and it might not be clear. You know what. It's just the way they are do not need to be under every single intervention, because you're not going to necessarily use different action steps.
That's kind of where I think they need to just be more generic.
Right. I agree.
Like, I mean, I think it should be more like this is your action step, this is who's responsible for it, this is when it needs to be started, and this is when it needs to be completed.
Right.
What resources do you need for it?
Right. Well, I mean, so there's a couple things that can be done. Either we change those questions around, right, because he hasn't finished the system. System hasn't been finished. It's not even ready. So either we change the questions around and accommodate what we want, or we make the whole planning section just an additional document that's uploaded into Echo as a briefcase and scrap part.
Well, do we find any value to the way work bundles are done right now?
No.
Then let's change them to make them action steps.
So
I mean, that's a good idea.
Action steps for specific things, like especially, I think from my perspective, it's most critical to have, for lack of a better word, action plans per environmental strategy. So an action plan for a campaign, perhaps an action plan for, again, you know, whatever we're saying is, I can't remember off the top of my head, sorry. Woo. Action plans for, you know, permanent medication drop box things, or, and also maybe an action plan for a YPE. You know, just in terms of, especially if it's a selective or indicated where we're trying to do parent recruitment or parent participation involvement types of things.
What if we have, so that's kind of a good place to tie in the guidelines that have been developed more recently. We're going to be revising the
campaign
guidelines later, as well as the communication campaign guidelines.
Right.
Oh gosh, we have so much to do. Oh my God.
Right.
But can we just, instead of, do we have to have those steps in there, or can we, you know, say these are kind of the standard things, make sure you incorporate the guidelines, steps, what do we call those, standards of implementation?
When?
What?
When? So when are you asking them to do that? I mean, for the purposes of this training, we don't have to have those steps done by January. What we're saying is, here's what's allowable, right? Here's what's, in my opinion, we don't need to have those steps ready until more towards the end of the fiscal year, like April, May, you know, so that people can at least, I don't know, I mean, I think you said, I'm remembering a May 1st deadline, and I can't remember quite what that was for.
And that was for when their plan is due. Okay.
So perhaps, you know, we create some sort of action plan. So we spend January 9th and 11th, and we talk about how to prioritize your intervening variables, how to select strategies that are appropriate and relevant. Here's the list of strategies that you can include in environmental strategies. And then they say, great, or, oh my gosh, you've overwhelmed us, or whatever. And then we do follow-up TA around this process so that people can actually choose these things. And then we do a series of, and I'm making this up, honestly, I mean, Terry and I talked about it a little bit, but then we do some sort of, what's the word, not, sort of introduction to environmental strategies, how to do specific things. And I'm thinking about this primarily, my best example always is, of course, the information that Illinois did. But so one of the ways that they introduced some of the environmental strategies and how to do them were online, self-paced, 30-minute sessions on how to do a compliance check, right? And that incorporated the best practice standards, and it incorporated things for, if you're doing a compliance check, you can't do it you have to work with law enforcement, and you can't be the enforcement person. You can only help recruit youth, and you can only do, age test verifications, or you could provide snacks, but you can't pay for snacks with the block grant. Those kinds of things. Just trying to give you an examples of, we would have to kind of figure out, and that's where Terry and I have had a bulk of our conversations, is how do we talk about 17 new strategies per se for some folks. Some people have already done prescription drug work, but how do we talk about that? What's the best way to do that in a way that will make sense so that people will at least have an introduction to how to do the work? And my argument is it's a lot of upfront work, but it's so critical to think through steps for the things that we think people are going to use most, whatever that may be. And then perhaps if there's things that we don't think people are going to do, maybe you prioritize that toward the end, or I don't know. It's a big undertaking, and I don't know. And I'm suggesting this only because, kind of seeking your direction and how you want to do it. Sorry, go ahead.
I don't disagree that it is worth doing. I'm just like sitting here thinking practically, how is that going to happen? Because as you guys know, I'm transitioning very, very soon. Sarah doesn't expect that she's going to be able to fulfill my position, or she's thinking it might even take 6 months. So, and I won't be able to have time to do all that with my new responsibilities. There's some places where I can help out. You guys won't have time to do all of it. So will we realistically be able to make those, or do we have to have some sort of more generic guideline?
That's a possibility. So again, coming from the
system, like I said, I don't agree. It would be really helpful for people to have it. I'm just like practically thinking, can we actually do it?
Well, maybe, and again, I apologize. For some reason, I cannot find the list of strategies. I had it like 5 seconds ago. So, maybe we approach it in some ways from a cures perspective, as in, what can we codify, for lack of a better word? What can we give guidelines for the easiest kinds of things that people can do right away? That's one way of thinking of it. So we could do, Dropbox days, or we could do, and for the things that are perhaps longer term, some of the policy work, perhaps we start them with planning standards, quote unquote, and then they have to get approval to move towards implementation of some of that. And I think, from my standpoint, I guess I sort of walked away, Melinda, with the impression that part of your work with Mark at Wake would be around some of these standards and sort of making them more universal. I thought that was, or is it more?
I think that's just more specificity than what will be reasonable. So we have, WIC has a few deliverables. So they have to make a baseline evaluation plan. Well, they have to make an evaluation plan and do the baseline for that. That's a pretty big chunk of work.
Right.
We're going to do a literature review to identify evidence-based strategies.
Why? Why is that?
We don't have it.
Yeah.
We have it for curricula, but we don't have it for anything else. And so to do a process similar to what we did with YPE programs, where we show, these are the things that are pre-approved, and these are the things that you have to justify a need for and show out what shows it's effective.
Well, wouldn't that be the same thing as here's the standards that the state has said? I mean, rather than doing a generalized literature review, wouldn't you do a review about the things that are already approved, and then you could branch out later? I mean, so, you know, doing a literature review on, again, starting with, I can't remember if it's CAPT or whoever put out the prescription drug informed strategies and implications for best practice. I mean, wouldn't that be?
Yeah, I mean, yeah.
Couldn't you come up with like based on your overall literature review, couldn't you come up with some guidelines or steps or whatever from that?
Yeah, so let me finish what they're doing. So they are going to do that kind of literature review to identify those strategies, and we're definitely doing it the shortcut way of looking at other good reviews and mostly drawing from those. They do also have to update guidelines for policy and communication campaigns, and I think we have in there to develop a systems guideline. I don't think we had anything in there for community-based process, so people could kind of really basically end up doing anything there. And those are the biggest deliverables. And you know, when in the guidelines, you know, we would develop, if they're not already in there, develop or refine standards of implementation, similar to what we did for YPE and parent education, where it shows these are the things you need to do, and those could be the basic steps, but they're not specific to, you know, drug takebacks or putting on a safer prescribing course or doing merchant education. So I mean, I don't think we can do them that specifically.
So let me also put this into our purview of conversation. I'm looking at the work bundle, and it literally is a name of a work bundle, an audience, a description, and then like action steps. So I think that we could potentially alter the way it looks if you want to have action steps underneath the interventions.
Can we open that up again?
Yeah.
I think, Jessica, you've already got it open. I think they might vary a little bit depending upon the strategy.
Yeah.
Trying to find the testing agency.
Yeah.
Yeah, you want me to,
so we looked at testing, you want me to look at like T&D or something?
I mean, sure, it's fine.
Sure.
Where'd you go?
Can you see me?
Where'd you click me? Yeah, but where'd you click on that from? That's not in the interview. Oh, no. Go to the interview.
Create or edit.
Okay.
You can see more of it.
Okay.
I think you could hit any of them. It doesn't matter.
Okay.
Go down to the...
Yes, yeah, sorry.
All right.
Always 4 steps here. All right.
Yeah, it takes too many steps to do that. Then click on that little thing with the arrow.
Save?
Yeah.
Yeah, you could do either. Either the arrow or the magnifying glass. It doesn't really matter. You're still going to have to go in to edit this section.
I haven't looked at my computer. I haven't touched my computer screen recently enough. I just got logged out.
I mean, that's all it is the section on I can't even see that, Jessica.
Yeah. Can you make it bigger?
Can you see it now?
No, you need to zoom in on your actual screen.
Make the text bigger.
I'm not sure how to do that with echo.
Here, wait. I'll fix you. Let me take back control.
It's fine.
I'm taking it back.
Fine.
Boy, you really took control.
Yeah, so here is prevention education. So let me go up to, tell me when you can see it. Is that big enough?
Yeah, that actually went out of my, that went out of my screen, actually.
I can see it fine.
Make it bigger.
But I've never had a problem seeing
We're
it.
good now.
Okay, so in the work bundle, like this one is under prevention education. So in the work bundle, the first section for drop down is like some basic obtain and develop materials, facilitate recruitment, participant. So it actually already has a drop down list of some basic steps that you choose. And then underneath there, you can do responsible parties.
Mm-hmm.
So in my opinion, these action steps underneath each one of these little ones, like if I put program initiation, I shouldn't have to have a bunch of action steps for that. You know, that kind of seems like what it is.
Yeah.
So,
but I wouldn't have to report on every single one of those things. Like, I don't know if you can go to the list again, like prevention education, researching best practices isn't necessary. Educating coalition members may be not necessary.
Mm-hmm.
You know.
Are all the important things there?
So that would be my question. Are all because I'm assuming they would all look differently, right? So if I go down to, all right, that's prevention.
And do those questions, do they fit, you know, if they did a mentoring program or a parent education program?
No.
Yeah.
I don't think
so. Go to part E under intervention work. Oh, there isn't even one, or is there one? Now, so add a new bundle for environmental. And then if you do that, it gives you all these options. So they are different. They just may not be accurate.
They're different so they're just different based on strategy type, not based on intervention type.
Right. Absolutely, yeah. So there are some things that are helpful, and maybe this is a starting point.
Yeah. I like it to be more generic just because there's so many things they might do that these don't fit.
You think they will fit or they will not fit?
Well, you know, like say you're going to do a safer prescriber training.
Right.
You don't really need to, well, your scan could be how much people are using the CSRS and what they're prescribing. You don't really need to the trainer should know what the codes are. You're not going to collect norms data.
No, they've lumped everything environmental kind of in the same category because they've got it geared towards they've got it geared towards the CSAP strategy. So they've got all of them. So
it's geared towards merchant education.
Well, I mean, social norms pre-data would be what you would do for a campaign. Focus group would be campaign. So they've kind of lumped them all together. They don't have them all, but they have some. Like, if we're looking straight off this list for, let's say, prescriber training, I would say you might have to plan with partnering agencies or engage them.
You're going to have participants.
Right.
But this is what I don't like about this. is
right, I agree.
It does have some generic steps, but it doesn't have all of the generic steps.
Agreed.
Has a pretty good list for a few strategies and a pretty bad list for a few strategies. And given that, I would feel much, much better if we just let people identify it on their own. Either that or make it so they all have a good list.
So, I mean, let me suggest an alternative, and I think Terry kind of mentioned it.
Yeah.
And this is, again, back to this sort of thought process of it's a lot of work, right? One of the things you could do is ask Marcus to, per environmental strategy, intervention, whatever we're calling it, to come up with a list. So you would see for LockUMeds there would be a list, for prescriber trading there would be a list, whatever. You could do that.
We'd have that list.
Pardon me?
What, Terry?
We'd have to give him that list. He's not going to create it on his own.
Yeah, Marcus, that was my reaction. You said it differently. You said it nicer than I did. I said Marcus can do that.
I mean, that's one way to use. So we could use the existing stuff, but we could modify it. Now, however long that takes, we'd have to find out. That would also mean we need to do pre-work.
What does he call it when things are dependent upon other things?
Well, I don't think this matters from when they're, I know what you're talking about, but this stuff, the work bundle, doesn't dictate any other field. So if we were to change, like, see this list of work bundle, if we were to go back in and to subcategorize this list for him, so if you pull up environmental, it still gives you this list, but it categorizes it.
Yeah.
And we add to it the things that aren't there. So we could take all his pre-existing lists for each TSAP strategy, and we could categorize them. And
what do you mean? What do you mean when you say categorize?
So, like, for example, when this pops up, it says collect social norms, pre-data, post-data. It would be like a subcategory for social norms campaigns.
Yeah.
Or something.
Yeah, I mean, I could see that. We basically did that with most of the process Part D questions, where on those broad categories, we subset them to give them a header, like you do this if it's YPE, you do this if it's parent education, you do this if it's mentoring.
Right. And then what we don't need, in my opinion, is I feel like this work bundle name should be, these are the action steps. I don't see there being a need for additional sub-action steps underneath each of these.
I agree. I feel like that kind of burdens things. But they have to be able to have, I mean, I think the work bundles really should be action steps. And
correct.
You need to know who's doing it, what's their timeline, that's not on there, what resources do you need.
So, I mean, that leads me to my second suggestion, which is we scrap work bundles altogether. We create a form that, you know, with that information, and they have to attach it in Part C, which is for each intervention that we mandate that for. So whatever it may be, environmental strategies, YPE, whatever. I mean, essentially what you're creating is a work plan for how do we do specific things. But my argument comes in, and I think this is the argument that we always have, which is not like a disrespectful argument, but sort of it's the rub between letting people say what they're going to do for certain things and mandating certain best practice steps that are involved with everything. And I think we've talked about best practice steps for YPE, campaigns, and policy I know are changing, but I think in order for people to make a connection between doing best practice steps, they have to actually articulate how they're going to meet each of the best practice steps at a minimum at this point for those three things that we already have in place, right? So YPE, campaigns, and policy.
So what if we scroll up? Can you guys scroll down? Whoever's got control of the screen. What if we under that first category? What if we make those more generic? So we already have like the audit criteria, which is basically best practice standards. What if we had them in that more generic term, and then under that they do a little bit more description that's nuanced for that particular intervention they're working on? Would that kind of address your concerns, Jessica?
Can you give me an example?
Well, so instead of, conducting environmental scans, collect social norms pre-data, this is a generic, collect baseline data. And then under the work bundle, they would say they were going to do a safer prescriber data. Their pre-data is that, only 27 prescribers are querying the CSRS, and they are prescribing, XYZ high-dose opioids at a rate of 200 high-dose opioid prescriptions per 100,000 people, or something like that. So the first one is a kind of generic. This is the broad standard, and the second category is how they're operationalizing it for that specific intervention.
That goes, in my opinion, well above and beyond an action plan. Like that's actually pulling together the stuff for each action step. And when I'm putting it in as an action plan, I'm not exactly sure. I'm just putting in the main steps that I have to do.
Yeah.
So so here's my example, right? I would use none of this stuff. None of these words here make any sense to me as it relates to work bundle name environmental.
I would.
The way that it makes, and I
think it's just an action step.
Yeah, but for what?
Well, it depends. It's everything. Well, this is so what you would actually see here, Jessica, is work bundle name for whatever intervention. Because this environment, where you see the word environmental, is the intervention name up at the top. Because it's the testing agency. So if I were to pull up one, it would say work bundle name project T&D, or work bundle name coalitions, collaboratives, or whatever. So it actually pulls the actual name of the intervention beside where you see work bundle name.
I think that's going to end up being a lot of work. I think Marcus is going to object.
It automatically does. Like if you look at the intervention, it's environmental.
Yes.
So it's
automatically. I hear what both of you are saying, and I can see the benefits to both of that. But let me tell you kind of where my brain's at. If I'm a provider and I'm doing an environmental strategy for the first time, I want to know what are the best practice steps. I want them outlined in the most general way. Again, I'm taking the things that we have from before. Let's say YPE, right? And then I need to be able to outline how I'm going to meet that step. So how am I going to, what's my plan for actually reaching 80% of the population and having them attend 80% of the time? So, in my mind, I need to be able to give a plan to the state in whatever manner, work bundle, an attachment that's an action plan, whatever. I need to be able to articulate if the minimum standard is I meet 80% of my participants 80% of the time, I need to be able to say I'm outreaching to, there should be, in my mind, there should be minimum steps for every core strategy and then even subcategories for environmental. So what do I do to actually do a campaign? What do I do to actually review school policy? What do I do to actually do a take-back day? What do I do? And then I should be able to tell the state, based on the minimum requirements, I have to do, in addition, to satisfy those minimum requirements, I have to do X, Y, and Z. And that's where it becomes, I'm telling you what to do, or Melinda, what resources I need, the deadline, or however you want to set it up. But I don't think it's helpful, in my opinion, to give generalized steps, ask for nothing else, you know, sort of people can write whatever they need to. But I really have found over the last 15 years, we've done that. We've given people, oh, go out and do this, and they do garbage. They do garbage. So then we said, okay, we're going to give you some steps. Well, then we gave them the steps, and then they didn't understand the steps. You know, so then we said, okay, we're going to give you the steps. We're going to show you how to do those steps. We're going to show you how to plan to do those steps, and we're going to provide TA. You know, that's how I see the next year of TA being, in my opinion, is how to help people walk through steps to do the strategies that they've selected. How do you actually implement? How do you plan? Whatever. But writing out a plan, in my mind, and then understanding why, you know, understanding best practice for that, understanding that I have to meet some of those, that I have to meet all of those, and understanding how I can go about doing that, to me, is at the core of what should be included. And now, is that something that can be done for everything in 6 months? I don't know. You know, should there be a plan to, for lack of a better, prioritize what we work on first? But I just think that a list of generalized stuff will get you generalized information, which will not be helpful, and the problem will still be that people don't understand how to conduct a campaign, right? We've given them the training, we've given them the standards, they're still not connecting the dots. We've given them, because they're not really talking about how they're going to do it in their community or their campaign or whatever. So that's where I see that there's a missing component. And the way that, I mean, I don't know, Terry, you know way more about ECHO, Melinda. The way that I see ECHO being set up, I don't see that that's something that can be done quickly or easily or without a lot of extra work. So I don't know if that's something you want to do. I mean, again, that's your call. But to me, the easiest thing would be, if you're requiring all this information, I think in the long run, being very prescriptive about basic best practice steps is how we can best move the system toward understanding how to do them. Now, does the best practice steps include everything? Probably not, but it's a start. So anyway, I'm done.
So go ahead, Melinda.
I just sent you guys the audit standards, because the audit standards is intended, and I would not say it's perfect, but it's intended to capture those best practice steps. What if instead of what we have as work bundles, we had the audit standard, which would serve multiple purposes, and that left it as something that could be updated, you know, like they could give examples of what that documentation is, but they update it as they go.
So, I mean, I'm just looking at
everything completely done. They'll know the broad steps, but they won't know all the details in the immediate, right? So their work bundles are things that should periodically be reviewed, what's currently a work bundle.
So some of the audit steps are things that should be in a work bundle perhaps, but some of them aren't. Like some of this I could just upload to show you that I've attended a communication campaign training, right?
Yeah, I mean, we don't have to have them all.
Right, so like.
So here's my thought. In my opinion, they can meet the audit checkpoint as a checkbox, but that still doesn't mean they know how to do the strategies.
That's my point.
So I think the problem, Melinda, is that we have people who can check boxes on the audit, but don't know what they're going to do with their time because they don't know how to do these new environmental strategies or these new community-based process pieces, because the audit is just a few things that are broad that they can check off, but then they've got all this time and they've got these new strategies, but they don't know what to do. They don't know the steps. So my thought would be, if we're going to utilize ECHO, which, so here's my thing. I'm not a fan of Part E, right? I don't love Part E.
Well,
but if we have this,
and we make it better.
I agree.
I mean,
my thought is, if we have the system, we might as well use it. So I think, if I'm hearing both of you correctly, we want to utilize the system because it's there and we have it. But the way it is laid out isn't the best means for doing it. So my suggestion would be to kind of like rotate back to what Jessica had mentioned at the beginning. See if we can take these, first off, get rid of the title work bundle name and make it more like action steps, and make it more like
or action plan,
steps or action plan, and then make it so this says the audience, the resources needed, and the time frame, right? Mm-hmm. And then in the drop down, we modify the drop down to put steps to help them, including some basic steps maybe that they need to do from the audit, and also including some best practice steps. Then we begin to help the state see, oh, if I want to do retail, here are some steps that's how I do it, because I don't know how to do this. Because the problem is they don't know what to do. So they need at least 4 or 5 steps to know how to get started. And then there'll be some extra things that they may have to do. But if if we have a reworkable list, I mean, we have a starting point. And I'm not a fan of everything in this list, but I do think some of it is important, and we can start to work from that and build upon it. Because right now, they have the audit guidelines that we can add in, but they don't have the actual practical, how do I do it? Because I can tell you, a lot of people can meet the audit standards by checking the box that they've taken the course. Because the audit standards every year, they've not been told they have to progress. So every year, I am meeting the audit standards by showing you that I have certificates. So I'm not actually doing all this work because I don't know how to do it. So I think we've got to give them some strategies on how to do the work.
Yeah, so I don't think we're very far apart, actually. So what I hear you saying, Terry, tell me if I'm interpreting correctly, and this follows up on what you were saying, Jessica, is like, okay, so the audit standards are not enough, but we need some generic standards. So we have something like audit best practices that generically fit everything, and then perhaps we have some follow-up things, like this is something that everybody needs to do regardless of what the intervention is for this type of strategy. And then there's a list of, okay, if you're going to do, say for prescribing, you need to do these things as well. If you're going to do merchant education, you need to do this as well. Would that work?
I think that's closer aligned to what we need, yeah.
Okay.
So, I mean, one of the things that I thought about for some of these trainings, these particular trainings, was to, and this is ambitious, but I'll admit that ahead of time, is to say, okay, we're going to work on prescription drug. We're going to talk about how to do prescription drug things. So not only are we going to talk about, and I'm not going to use audit, but let's say we come up with 5 steps on how to do each of the 6 or 7 interventions for prescription drugs, the evidence-informed interventions. Again, I'll go to the one that I know most off the top of my head, which is the prescription drug take-back. So here's the 5 steps that we think are, at a minimum, are critical to do, right? And so I envision creating sort of a resource for people to be able to say, okay, I want to do prescription drug take-back. here's the 5 steps that I should start with. And then also, you know, again, this kind of goes back to why I was asking more about what Wake was going to do in terms of literature review, but it also goes to speaking to some of the concerns about choosing. So, I mean, I would say, okay, here's a prescription. You should do prescription drugs if you have these priority intervening variables identified. Number one, you should do prescription drugs, take back if you have these community partners on board, or you can get them on board in a short amount of time. Here's a sort of a generic time frame as to how long it would take to do it. You could do it within a year. I'm making this up, you know, but here's some things to consider when talking about fit for your community. Is this an appropriate strategy for your community? Do you have the staffing in place? Do you have the buy-in in place? So, I mean, that would be sort of guidelines for how to think about doing, not only doing a prescription drug take-back event, but also who do you need to have in place? What does your data need to tell you in order to get you to select this, and whether or not this actually fits for your community. I think I've yacked about this before, but I envision that type of information, that depth of information for each of the environmental strategies that you've identified, Melinda, and I can't remember them off the top of my head. And that's ambitious to do in 6 months, right? That takes a lot of work, takes a lot of thought.
I don't think we're going to get there, but I think if they know we're going in that direction, the more we provide progressively, the better, because we can eventually get it.
Yeah, I definitely have that for alcohol. I mean, but we don't have a lot of alcohol strategies. We have more prescription drug stuff where we're really, really interested and concerned about tobacco stuff. I mean, definitely. I can provide you sort of, as we go through this and as I start thinking about it, if I have time, I can kind of provide you an example. Again, we don't have to use this, but I mean, some of the work has been done by other people for this. But that's sort of how I envision teaching people about how to do each one of these particular interventions, is that not only do you need to know certain things, you need to also understand capacity and understand how it fits with your needs assessment and how it fits, even costs too, right? Well, I mean, there's certain costs associated or resources or whatever. And so anyway, blah, 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 I'm done.
No, and Jessica, I think that ties into what Melinda just said about some generic overall. So generic overall steps for an action plan could be, you know, ensuring partnerships and funding for the strategy. You know, you could do a couple of things like that that are generic across the board that you would want to have.
Can do that without, I don't know if you can say that without knowing particularly what you're going to do. I mean, how do you know?
This is once you already have these interventions and you've chosen the interventions. When you go to make an action plan for the intervention, then you already know some generic things that are in the list as overall arching steps to make your intervention successful, like action steps. You know, having the right partners, you know, communicating with your partners, or, you know, determining the resources needed. You know, some generic things, because I do think there are some generic things that overarchingly are needed for no matter what you're going to do, or pretty dang close to everything you're going to do. You're going to have to have some resources. You're going to have the capacity to do it. So, because here's the thing, if we align it currently how it is aligned to the intervention. It's not aligned to the overarching strategy, which is kind of great for environmental and can be more generic for some of the other ones, or not important for information dissemination, right? Not something you want to necessarily outline. So I think it has to be
I wouldn't outline steps for anything that's not core. So anything, and I would even argue perhaps outlining steps for community-based process isn't the first thing you should focus on. I would really outline steps for environmental strategies and YPE or education or whatever.
I would agree with that. Melinda, how do you feel about
it? Yes. You know, we really already have it for YPE and for parent education. I think we need to do it for policy and communication campaigns. I think ultimately we probably should do it around community-based process, but that's going to be probably the hardest one.
Well, and also it's done very differently. And I don't think it's necessarily, you don't have to necessarily set out a strict regimented action plan for that as you would in a policy or a prescriber training. So I think we can look at maybe some generic steps if you want to have some. But, you know, my thoughts would be this going forward, and I'm also looking at time because I got to jump on, otherwise Anna and them will not have a webinar. My suggestion would be this. Moving forward, telling people that they need to enter the hours and the process numbers for the strategies that they're doing for this 6-month time frame. And then working towards fixing Part D, E, and whatever else needs to be fixed in the system to capture what we want for the fiscal year 19 strategies.
Yeah. Yeah, we definitely, I mean, we could be as far as the audit and the guidelines for the January training, but, you know, I think we agree that won't fully capture what we need to capture.
No, and I think if we tell the state that the only thing they need to be focused on capturing between now and January compliance are the hours for their interventions and their reach, then they'll be in a good place, because they may or may not use every single intervention they're doing now after they've looked at their needs assessment and prioritized.
Yes,
fiscal year
do it for things moving forward.
Yeah. And then we have time, because I know Part D hasn't been modified. They haven't changed it. They haven't changed the process questions. And then we still have to work on Part E. So it would be futile for the state to put in everything in full. So then we, at the planning and prioritization training, if Jessica will kind of do some revision and putting together some content to shoot over to Melinda, and then working world, you know, I think the regional type style of TA works really well. If we were able to do some regional pieces so we help them after they've identified some strategies for fiscal year 19, if we can do some regional and webinars to help them identify some action steps, then we can have them, you know, come April and May, start putting in, you know, copying over the interventions they're going to use and putting in the information accurately into ECHO, because it'll be complete.
Yeah.
Jessica, what do you think?
Yeah, I think you know, I kind of got more lost in the details of some of that, but I think overall in general I would agree. I still don't necessarily agree that there's general steps that every strategy, intervention would be, but you know, that's neither here nor there at this point. I mean, there may be.
I think
it's hard to
hash it out.
Yeah, I mean, it's not worth discussing anymore today. As long as we can agree that what should be due this year, and not that I have a say as to whether or not it should be due or not, but as long as we can agree to sort of a plan moving forward for how to help people start to action plan what they want to do for next year, I'm good. I mean,
yeah.
So, and what you've said, Terry, fits pretty much in with what I think should happen as well.
So, Melinda, is that comfortable to you?
Yeah, I mean, I'm hedging a little bit. I think we have to be practical, and so my practical side of me says yes.
Okay. So if we could, and I mean we as in you, because they don't care so much what I think. They truly care what you think, Melinda.
I don't know that. I think they're cursing me.
Well, I don't think they will if they see, you know, a united force, but I think if we could send out something to them to say by January, what you need to input into ECHO is your current intervention that you are doing, the hours monthly and the reach monthly. And then other things will be, you know, held in the future, because they won't need to do Plan D at all, Part D at all, or Part E at all between now and January. And I feel like that, because it's A, not ready, and B, we want to make sure that it's in a place that will help them for fiscal year 19.
But then, so that will be due in January, and then so going back to our original kind of core question about the training.
Mm-hmm.
What are we going to have them submit? We identified a day of May 1 for submitting their action plan, and we did that so that we could review it before contracts were written.
Mm-hmm. Well, I think we can feasibly do some sort of action plan. It just won't be done at the training in January. It'll have to be done through some webinar structures and maybe some regional meetings. But that will give us time to develop some steps.
But we have to know what it's going to look like to tell them at the training.
What do you mean?
I don't think we have to know that soon. They don't have to work on it yet.
So, I mean,
well, they're only going to have a couple of months afterwards. They're going to have 3 months to get it done.
So what ideally, if we could do something in the next, essentially it's 5 weeks, along those lines, don't forget like a week off between Christmas and New Year's, and so it's like 4 weeks. What would you like to see in terms of a takeaway for their future reference?
Well, you know, I want them to, I think it is helpful if their action plan is in ECHO under the work bundle. So I'd like them to know some about using it for action steps. Now, that would mean we'd have to at least have those generic action steps in before then, which I suppose we could leave as is, because there is a other category. But I don't know. I mean, we basically have to have some kind of template for them on what their action plan is going to look like, their strategic action plan. So that'll include whatever their prioritized strategies are. And it should include their action plans, action steps, their who's responsible, their resources, their timeline. So that means we at least need to have partially completed that list, even if we're going to fine-tune it more later.
I think it's reasonable. Pardon me, are you done? I didn't want to.
Go ahead.
I cut in. I think it's reasonable to create a template for an action plan with what you just talked about, the prioritized intervening variable, how it connects to their strategy, the action steps, who's responsible, resources, and timeline. I think that's doable. Mm-hmm. I think in general, as Terry said, I mean, and I'm more of a visual person sometimes. I think in general, once I look at that list of, you know, environmental strategies, I think there will be some common steps that are necessary for all things. Now that I'm kind of taking a step back, I think it's reasonable to think through that, whether that's presented a little bit at the training or whether or not that's given to Marcus and sort of thought through how we can work the quote-unquote work bundles better.
I think we can do both. I think, Jessica, we can do both. I think we can give Marcus some guidance on how we want it restructured. Because, again, he's got to do a lot of restructuring. A lot of things are still not up to par. Right. So I think we have some leverage. I think you and I can sit down and start looking at those massive lists from each strategy for the steps and start adding some different ones and recategorizing. And I think that we can provide them some sort of plan that they can look at the training to begin to see, and then translate it into ECHO, because we will work with him to make sure it looks similar.
When you say plan, what do you mean plan?
Like those action steps, like you were saying, the connecting, the intervening.
Okay. Okay.
And I think that we can then translate it into ECHO, so Part E will look like those action steps that you're going to put in that document or whatever.
So it sounds like, I mean, they're going to walk away with, oh, here's some environmental strategies I can do. Here's how they match up to the prioritized intervening variable. I think it'll take them longer than just one training to prioritize their intervening variables, by the way, of course. And then it sounds like maybe they'll have an action plan. They'll see how it maps back into ECHO. They'll know that there's certain steps that have to be done regardless of what environmental strategy you're doing, perhaps. Would that satisfy kind of where you see this training headed?
Yeah, I think so. I mean, that's what they need to come out of it with. They're obviously not going to be able to accomplish that all in the day, but need to just make sure they have the tools for that.
And then I hate to ask this, but I want to check because I know we've heard it a couple times. Where do you stand on what needs to be discussed related to the, you're going to kill me, Jessica, but related to the risk and protective factors and related to the, the
community readiness?
But that's not what I was thinking. Related to the socio-ecological model. Social ecological model stuff.
Not going to be able to.
I am shooting you daggers.
I know you are.
So I don't think we'll be able to capture the social ecological levels in that training, although we maybe could briefly introduce it, but have low expectations. But you know, what they're checking under risk and protective factors should be what their intervening variable is. Now, Marcus and I went round and round a couple of times about the risk and protective factor list, and I really wanted it to be intervening variable list, and he made a rationale for why it needed to stay risk and protective factors, because based upon research, blah, blah, blah. But it's not really a perfect list. So.
Well, and they haven't been using it yet.
Yeah. But they should be addressing that in their strategic action plan, because, you know, how are they going to know if they're successful if they don't know what they're changing? And, you know, how they're going to produce their change in substance use behavior is through that intervening variable. How they're going to, that intervening variable is through their specific strategy that targets that.
Right. So then my question would be, can we guide them to choose? So once they've identified the intervening variable in the training, can we say this now goes in the ECHO risk and protective factor section? Now you can.
That they know, but.
I mean, I just know because they've been, you know, choosing any risk factor that's in that list, and I'm not sure how helpful that is.
The risk factor that they choose should come from their needs assessment.
Right. Well, I mean, right now we know that that's not happening because they haven't seen their needs assessment fully, so they've just been putting them in. For the future, I would most certainly.
So the way that we've set it up is risk factors in some ways equal intervening variables, right?
Yeah.
So there's what, 6, 8, I don't know, I'm making that up. But, and then, you know, not to further confuse the issue, but in some of those in some of those intervening variables, you know, social access also can be, there's a lot of different things that could, risk factors in his list that could actually map onto social access in addition to social access. So that's where it becomes confusing for me because you really could check several different boxes. So, I mean, ultimately,
I would think you could check more than one box in the risk and protective factor list.
Yeah, but there's a lot of things in that risk and the protective factor list that are completely
like poverty.
Yeah.
Oh, yeah. There's some that are like DSM-4 or 5 categories in my mind. Like school climate. Well, is that addressing, you know, like the school policy change? I mean, but I mean, it doesn't map on to how we've identified it. I mean, so I'm not denying that Marcus has great research stuff.
That's parental monitoring. Parental monitoring could tie into your easy social access, right?
Yeah.
And so can like a favorable attitude kind of thing. So I think there are some things, there are a whole lot of things that they're just choosing, Melinda, because they're on that list.
They're just checking a ton of things.
Oh, there's a ton of things. And I mean, they're just choosing things because they're like, oh, it's particularly with curriculum, right?
This could
curriculum may
right?
address, curriculum may address school grades or dropouts or whatever.
Right.
And so they're
and ultimately what you need to say, I think I've heard you say this, Melinda, all you want to know is, did they choose the right strategy, intervention strategy to meet the intervening variable / risk, right? I mean,
yeah, I mean, that's the most important thing is that they're choosing the right strategy for their risk.
Right.
And that's where I think,
Can't he add an intervening variable column? Like, can't he add a question for intervening variable and they choose from the drop-down list?
Well, do we want them to have both? I mean,
we can have that bother me.
And about changing that label. Because what I would really like to see, so, you know, every strategy should have a primary intervening variable that it is addressing. And then what he's labeling as contributing factors are what we would say are root causes or kind of about why here. And so they should have some contributing factors that are directly related to that intervening variable or risk and protective factor. So, you know, there's going to be multiple ways that you're going to target your social access or, you know, whatever it is.
Correct. Is there value in that at this point? I guess. I mean, like, yes, that can be done. It can be done. It's one of those things in my mind that is nice, but not necessary at this point.
Yeah.
Yeah, I think if we had, I think it'd be almost easier to allow him to keep his massive list that he loves, and then to add a question that says intervening variable, and then put our drop-down list and call it a day. Because he's still fixing forms, right? So that's a new question we could add and let him keep his list. And if we want to dive into other factors in the future to expand upon their work, then by all means we have that option later. But
probably there's only, well, I haven't looked recently. There are a few things missing that I would like on there, but there's more things that I don't want on there.
I agree, and I know he hasn't touched them.
Oh, me too.
He hasn't touched those.
No, he hasn't touched anything, really. He hasn't fixed, he hasn't even done sign-R. So, I mean, there's a lot of things that he's yet to do.
Told me once they got their payment, the evaluators could start helping.
Well, that's promising.
Payment's supposed to be coming on Wednesday, being sent out Wednesday.
Oh, tomorrow?
Uh-huh.
Well, I mean, so my thought would be, since we've got the opportunity to kind of fit and we need to fix everything, let's just, I mean, why not add it? And that way it'll give you exactly what you want, and then it'll allow us the option to do stuff later.
Yeah. That to me, I don't want to deal with that right now, because that's going to be something that changes for all of them. I need to get back. I need to collect all the recommendations to say, okay, you know, to regroup where we were, these are all the things that are supposed to be happening under each of these different strategies.
Right.
Because I suspect he's not going to be able to, he's probably not going to have those all archived easily.
Oh, probably not.
So, but that is something, I mean, my preference still, and I could have that conversation with him again, is that we have that intervening variables list, and then what factors contribute to it that are being addressed.
And then, I mean, and we'll still have to give him E, which we can do, and I think he'll be okay with that once we fix E.
Give him which one?
E, like a revised E with the actions. I think he's willing to work with us, and if we cease entry on those other pieces that are changing,
that will make him happier.
Yeah. And the state will be happier.
Yes.
So
and
here's one thing that I will, here's one thing that I will say, just because it's popped in my head and it relates. I think it's worth, Melinda, I don't know if you have any vast amount of time to think about this, but I think it's worth to look at those questions per intervention, you know, some of it, and to determine whether or not what we're creating with the work bundles or action plan or however we're calling it, whether or not that answers some of the questions, so that perhaps we're reducing the amount of questions that people are answering in addition to detailing steps for how they're going to do their work. That might also create some goodwill because some of those questions in my mind, if I can remember correctly, are redundant, or they're redundant across sections, or some of it they're asked in a confusing manner, which, so I mean, maybe look toward those questions per intervention to determine at a minimum, perhaps maybe what you want to ask versus asking everything. I don't know. That's just me.
I'm sorry. I drifted.
It's okay. I think we're all burnt out.
I'm so sorry. I really spaced out at a really inopportune time.
Well, and I'm going to have to literally shut y'all off.
Yeah, it's gotta go. I can if you want to. Can Jessica?
Yeah, I'm here. It's not a big thing that needs to be done, but Carrie, do you need to go?
I don't know. I literally really just totally spaced out.
That's okay. I understand.
I'm feeling overwhelmed with all of the things that I need to do, and there's a lot that they don't have as firm deadlines as some of the things that we've been having. And so I have to step back and kind of think holistically about the things that need to happen and kind of mentally be prioritizing.
Sure.
But,
and mainly my suggestion was to consider holistically from a bigger picture.
Yeah.
Some of what I understand what you have to do as a process is to give him questions per intervention.
Yeah.
Right?
Yeah.
And I'm wondering that since we've had this discussion,
he just hasn't carried them out. We've actually, I mean, he should have them all, but he got them in parts, and I want to give them to him all at once. I'm going to go back through my emails and give them all to him. But I think you were going to say something about what to address about in the work bundles and stuff.
Well, I mean, what I'm saying is perhaps if we create a different way of going about the work bundles, maybe that's answering some of the questions that you're asking people to answer. So maybe I'm not asking you to do it. You don't have to reduce the number of questions, but perhaps based on our conversation today, when you go to that time and process where you can go through and look at all the questions again, perhaps think of it as, can this be addressed is this the best way that this can be addressed in this question, or can it be answered in a work bundle or something else, so we're not overburdening providers with having them fill out so many questions, so much action steps, blah, 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 blah. Again, if what you have is so critical and so important, and I'm just not, because I haven't seen the questions in 3 months, that's fine. I'm just sort of trying to help you think about reducing some of the reporting burden on providers. That's all. But I don't have a full picture.
What I did for those, so as you might remember, a lot of those, like particularly in environmental strategies and information dissemination, they had a humongous number of questions, many of which, in Part D, many of which did not apply to everything. And so I clustered them into groups by surface type. And so I put, now to make it so only those ones show up was really, really complicated system-wise. So what I basically did was I just put a header on them so providers can know that if they're doing a, oh gosh, I can't even think. If they're doing a environmental influencers training, you answer these questions. If you're doing a youth environmental management strategy, you answer these questions, so that you can go right down to the ones that are really relevant, and it makes it a much better list.
Yeah, and I don't know if Terry's still on. Doesn't matter if she is or not. I'm not saying anything she wouldn't need or so I guess my concern is, and I'll make it brief, is that if the expectation is that I do work bundles, for lack of a better word at this point, we're calling them work bundles right now. Let's say I'm a provider, I'm entering in my environmental strategy, so it's my understanding I'm entering my intervention, I'm answering all the questions in Part D, it sounds like. I'm entering the REACH, I'm answering REACH questions, population questions, whatever that may be. I'm also entering in the hours, and then I'm creating an action step or action plan as a work bundle. And that feels like a lot, right? And so I can see where perhaps some of those questions, like for information dissemination or for, and I totally agree with what you said about categorizing them better. I think that's great.
Yeah.
And only
really
having certain questions. Yeah, only having certain questions for whatever I've checked, as you said.
He has the AD brain.
Right? So, like, if that, so that makes it, so I guess the questions, a lot of those questions make sense for things that you're not doing work bundles for, right? So I think we've agreed that perhaps information dissemination, alternative activities, problem ID and referral, we're probably not doing work bundles. Maybe there's an exception, I don't know for sure.
Well,
but
I don't know. Well, information dissemination probably doesn't make a lot of sense, unless it's something like conference planning or health fairs. It's
I don't
like
know if I could.
Or a radio interview or things like that.
Sure, I mean, I guess my point is, if it feels like a lot, and it makes sense to have questions for things that you're not seeking a lot of additional information for through work bundles, right? But I don't know if I would have providers, as I mentioned, for environmental strategies, whatever strategy I'm choosing, it feels like a lot to enter all of that information in plus work bundles. So answer all the questions, because I feel like, and again, I haven't looked at the questions, and I know that they're not finalized, but if I remember, it seems like some of those things could be answered by virtue of talking about what I'm doing or putting a timeline.
I don't think it'll be as big of a deal once they get finalized, Jessica.
You're not supposed to be here anymore.
Oh, listen, let me tell you, I'm a killer awesome person. I can run 2 webinars at one time. I didn't even know that was possible.
Hilarious.
I've got 2 phones. I am set up, dude.
Yes, I like it.
Imagine hearing you project that onto the other teleconference.
No, man, I've got everybody on mute. We're good. Got 21 people who have no idea I'm on another call.
Awesome. Sorry.
I think it's hilarious.
I heard your voice.
But, well, I mean, no, it's awesome.
My point is just I think that they'll be complete. I think that it won't be as bad because Melinda knows a lot of those questions she didn't like. So she was working through
I got them down.
Yeah, massively.
Okay. Cool.
So we'll be okay.
And even if they weren't cut down, they were at least organized, so you don't have.
Sure. Yeah.
You're answering just a small portion of them.
Mhm. Absolutely. And plus,
I do hear Holly though. I do hear her talking.
Yeah. Well, you're gonna have to hear that because that's just the reality. I turned her down, but I at least have to hear something crazy happen. But the biggest thing would be if we're not going to have them do, if we dictate what things they really have to do, the action steps for and what they don't, it'll cut down on the work dramatically. And I think that we'll be able to fine-tune the system. Because right now, there's just so much that needs to be done in the system to fine-tune it that I think we're in a good place to move forward. Does that make sense? Like, I think there's some good places.
Yeah.
Yeah, I think again, if you allow my opinion on it, I don't know if I would see the value of, hello?
Go ahead. You're here.
Of action planning health fairs or conferences. But, again, that could be something that would be talked through later. Hello?
Yeah, I think I agree. There's the parts that we need more immediately, but kind of realistically, Marcus hasn't done those changes, so I kind of think we should probably just do them as holistically as possible, given where we're at.
Yeah, and if we can get the list kind of together and get him those as well, I think we'll be good.
Yeah. So here's what I'll do. I'm not going to do it today. Probably not going to do it tomorrow.
We can all look at that. It's not like you have to do it all by yourself. We'll all look at it.
If you want our help, that is. I'm just teasing. So let me wrap this up from my standpoint in terms of what I will do for you guys. Not going to be this week, but after Thanksgiving, I'll revise the planning and prioritization. I'm going to actually do a draft strategy matrix, and I'll start to put together some slides because I'm really cutting and pasting from a lot of the work that I've already done. But I will definitely give you, at a minimum, the agenda, and then I'll start to build out the one-day materials. Again, I don't think it's going to be as burdensome, perhaps, as some of the stuff in the past. And then if you get a chance, it's literally 5 minutes looking at this to make sure that this is where we want to be, and then we'll go from there. How does that sound in terms of content for this training?
Yeah. I'm going to bring up one more issue, though.
Perfect.
In thinking about their strategic action plans. So I do mostly want it to end up being an echo, but they probably actually need to have it in another form first because they're going to have multiple, what Marcus is labeling as contributing factors for each intervening variable. They're not going to do one strategy for each intervening variable, most likely. So we need a document that shows they're really addressing it in a meaningful way.
What do you define as meaningful? Like, do you recommend, let's say they say the recommendation is that they choose 2 priority intervening variables. I'm making this up.
That's exactly.
Do you recommend 2 strategies per intervening variable? So 4 strategies per action plan? I don't know.
It really just depends. You can't really say that, but I agree that it's a small number of priority intervening variables a site should have, but they're probably going to need to be addressed in multiple ways.
So what about saying
2 to 4?
So then we talk about small agency capacity.
Yes.
And then we said, I could just hear like Power View or somebody saying, we only have 1 staff or 2 staff. How do we cover that in 12 counties? And then somebody else, oh, we only have 12, we have 12 counties. How do we do that across the board? Or inside on the ultimate other side saying, we've got 20 staff, we've got 12 counties, blah, 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 blah. I mean, I think that's a really practical concern. I'm trying to figure out how best. I don't know whether or not, believe it or not, I'm actually going to be the one who's not going to be less prescriptive by saying something like, choose however many intervening variables that make sense for your staffing and the size of your agency and what you think you can identify or what you think you can address first or whatever. And then maybe we ask at the end of the action plan sort of a rationale for why agencies chose the way that they did. Maybe they say, oh, we don't have enough money or we don't have enough time or this is really a concern in our area and we have the support to do this, so that you can see maybe why Jessica Dickens' agency with 4 staff chose 12 things versus Terry Moy's agency chose 20. I don't know. What do you think about that?
Well, you definitely have to consider practical, what you can kind of do capacities in your assessment. I think when you're one of those small agencies with a really large coverage area, you have to be more creative, I think, about how to reach your catchment area. I would suggest that some of our small multi-county providers really, they substantially reach a very small portion of their catchment area. And that there's a lot of communities that are realistically missed. I think that it would be helpful for them to think a little bit more creatively, and here I'm thinking about Diane most explicitly, to be more creative about how she could address the needs of her catchment area. But
well, I think the other thing
I don't think there's one right answer for how many.
It also may be it takes them a year to get to the place where they can actually do another strategy, especially if it's a new one, because they have to build more capacity, so it might take more time.
Right. Or it might be like community-based process work.
This is a 3-year action plan that they're going to be working on, so it's not something they have to have done all in 1 year. So, but I'm just thinking, you're obviously not, if overprescribing is your intervening variable, or let's say not overprescribing, that's too specific. If prescription drugs are easily available is your intervening variable, you're not going to just do a safer prescriber training. You're probably going to do a safer prescriber training. You're probably going to lock your meds and try to increase secure storage capacity. You're going to work with your law enforcement and maybe pharmacies to increase safe disposal options. So you're going to, I kind of with that in mind, I think we don't want people to have too narrow of intervening variables. They should be a little bit more broad. Which I think, Jessica, your list that you have, that matrix that you did that shows basically like social access, retail access, advertising, whatever else it shows, is a pretty broad list.
Right.
And then the contributing factors, which are what they're going to more directly address to modify the intervening variable, is going to be a little bit more narrow, and so those are the ones where I would expect to see. I don't want to prescribe a number, but you need to make sure you're not just. It's not, those intervening variables are not a problem just from one angle. And so you probably can't just address it through one angle.
Right. So let me, because I don't know, somehow in my mind, the fact that this is a 3-year plan is just now hitting for me.
Yeah.
So I think that makes sense. So here's my concern, not about a 3-year plan, but how it's rolled out to providers. So how providers would think about satisfying a 3-year plan. My concern is that providers, number one, and this mainly really relates to environmental strategies. So if I'm a provider who's never done a lot of environmental strategies, and this will be easier for others, by the way, I'm thinking of a Diane, right? Power of you or whatever. We'll go with the lowest common denominator.
Probably about the midpoint provider, somebody who is
I mean, but
has some strong capacities, but needs to develop some other areas.
But so even so, if I don't quite understand how to do them, and I don't understand how long it'll take necessarily, and I don't necessarily have all the supports in place, it may take longer to do some things rather than others, right? And so it concerns me that the expectation, and maybe I'm misunderstanding, but it concerns me that it sounds like that the understanding is that I'm going to create this 3-year plan, and I should know how to do, how this is all going to look and how it's all going to fit in 3 years, and I need to do boom, boom, boom. And I think for some of these folks, legitimately so, they will have to build some kind of capacity to do stuff. They will have to do, and so sometimes what may look like not a lot of work is really there's a lot of work being captured in other ways, number one. Number two, sometimes just because you think on paper that it'll work, it may look completely different overall. So what I'm thinking about is mainly, given that some of this is new work for people, would you be on board with saying, yes, this is a 3-year data cycle, but we want to know what you're doing every year. So we want to know, can you just project out for 1 year, right? Can you project out the work you're going to do for year 1? Can you project out the work you're going to do for year 2, next year? Rather than saying, I need you to project for the next 3 years, and we're going to hold you to that. Again, I have seen it done in other states, Illinois, where they say it's a 2-year work plan. Well, what happens is things happen, people change, the turnover comes in, there's new knowledge that needs to be built, and ultimately, after every year, the state is getting inundated with requests to change their action plans for whatever reason, legitimate or not, right? And so just try to head that off at the pass by saying people change, people don't understand, it takes longer than you think. It's hard to plan out for 3 years when you don't know what you don't know you're doing. And it's great that we don't have to collect data every 3 years. I mean, from a sheer planning perspective, because this has been quite a beast, but perhaps the way that we roll out this 3-year plan may not be, it could be incremental versus here's our plan for 3 years, this is it, I mean, those are my thoughts.
I would have to 100% agree with you. I can't imagine rolling out a 3-year plan where people don't understand that it might take 3 years to do some of this work.
Well, what if, well, we don't want them to have to do it every year because we wanted to tie it to the needs assessment cycle. What if, there's like a broad plan and you have updates as you go. So you don't have to, for that thing that's not going to start for another year, you don't have to have your action steps. You don't even have to enter it as an intervention in ECHO yet. But you know it's on the horizon. So I don't know how we could kind of stagger that in our plan, but say like the action plan basically it completes your intervening variable you're trying to target, what those contributing factors are, and what interventions you think you're going to use, but it doesn't have the action steps. No?
Yeah, no, I mean, yes and no. So I think, like, it's critical for, obviously, some things take longer than others, right, regardless of what we're talking about for environmental strategies. I think it's critical that if you want them to create a longer range plan than 1 year, and I'm just sort of, again, thinking off the top of my head, I think it's critical for you, for there's to be some sort of touch points. So if I'm looking to create, I'm making this up because I know this is not a possibility, but if I'm looking to do a social host policy, I need to be able to realize that there are certain planning things that I need to have in place. So rather than the fact that it's probably not going to actually happen until year 3 maybe, I need to be able to say, in year 1, I'm doing these type of things. In year 2, I'm doing these type of things. In year 3, oh, we're finally going to get to the point where we can get this on a, get this bill looked at by city council or whatever. So, in my mind, the way that I've always sort of taught environmental strategies is sometimes there's easy wins that you can do first based on need and whatever else. In my mind, it seems as though perhaps detailing out what we're going to do first and then probably detailing out planning or however we talk about it for things that are long-term, long-range. I think if you just say, oh, I'm going to do it, I don't know when, I don't know how, it may not get done, right? I mean, I don't know. It's just me.
Okay. So what if, just thinking about that kind of hard copy that's not ECHO, what if it includes, it's basically in the logic model template, and it goes through your prioritized interventions, your contributing factors, the interventions you're going to do, and it includes a broad timeline. And so, but then, for those ones that are earlier, you do have your action steps in ECHO. So you have some of those timelines to be thinking about when you need to start, so it doesn't totally fall off the radar, but you don't have to get ahead of yourself in details that you don't yet know.
Melinda, how many people have done a 3-year plan like this? I'm concerned that they don't even know, like, my big concern would be they don't have a clue what a 3-year plan entails because they don't even understand the strategies well enough to make a 3-year plan. Like, I mean, I don't know. I just, that worries me because I don't know if they even understand, how long it will take. Because some of these things you may have to do, like, say for prescriber training, that's not going to take you 3 years, right? But you may want to do it over the course of 3 years, right? You may want to, because you may have a lot of prescribers. But, so so I'm not sure if they would even know to do that 3 times. I'm not trying to be negative, but I just don't know if any of these people have worked off of any real plan for 1 year, much less 3.
That's what I would tend to agree with. And
I'm not trying to be real negative.
Honestly, I mean, and I'm not trying to be negative either. I'm just trying to be sort of, I want this to make the most sense for all of us, or at least a good compromise for all of us at some point. And for me, I guess this is the first time I'm hearing, or at least it's resonating, that it's a 3-year. I mean, I know it's a 3-year needs assessment cycle, but I didn't realize there was an expectation of a 3-year plan. And I can just say from my experience in other systems, we can ask for a 3-year plan or even a 2-year plan, and what happens is ultimately things happen, things change, and you get inundated after, at the end of every year with, I couldn't get this done, I can't do this, my person left, my community, my principal left, all sorts of things that you can't plan for, unfortunately. Well,
and I'm not,
and it's going to
and,
change.
you know, I'm looking at, I don't know how to do the strategies asked for policy.
Right.
So I don't know, I don't know what has been expected in year 1, year 2, year 3.
I mean, and some of that can be helped, but it can't be helped by May 1st. I mean, there's just no way that you can help people understand how to do the work before they do the work. That makes sense in a short amount of time.
So can they do an actual plan for a year by May 1?
That's what I'm advocating for. Yeah. And you can even have a list of things that I want to do, like year 2, year 3, but you know, based on
and then we could dictate to them, here's some strategies that that if you choose X, Y, and Z strategies, they will probably take 3 years. So here's some ideas for steps for year 1, particularly around policy, right?
Right. They're planning steps for year 1. There's probably advocacy, maybe, I'm making this up, advocacy for year 2, maybe, and then implementation for year 3. I mean, you can have steps per policy, perhaps, or, you know, I mean, whatever. I mean, and you can even say, like, if you get through a planning phase for policy quicker than you think, then move on to advocacy or whatever we're calling the steps. I mean, so there's flexibility, but there's not this sort of rigid structure of this is what you must do by year 3, and we're not revisiting it, or you must have everything spelled out in advance, or else then we get back to the am I in trouble if I don't have it all done? You know, I mean, that's what I'm trying to avoid, or so on and so forth.
Yeah, I think it would be foolhardy for us to expect things to be exactly the same at the beginning of year 1 as they are at the end of year 3. I think it's probably even foolhardy to expect they'll be exactly the same at the end of year 1 as they were at the beginning of year 1, because things happen. So it's just kind of a guide to make sure you're addressing your intervening variables, but where the details need to be is really in that first year. Is that what you guys are saying? No?
Sorry, I couldn't get off mute. Maybe that's a good thing. What I'm saying,
I must be really wrong.
No. I mean, yes and no again. So what I'm saying is we really help people think through what they can understand and accomplish in year 1. And that's going to look different for different agencies, right? Power View is going to look vastly different than, oh, it's snowing here, by the way, sorry. Power View for year 1 is going to look vastly different than Deanna's year 1, right? They have more capacity, perhaps. They have a better understanding of environmental strategies. I mean, they might be able to project out, you know, with greater clarity or greater understanding. Year 1, just to me, from just a sheer administrative standpoint, in terms of a monitoring standpoint, because I had to actually review strategic and action plans for grant providers back in the day. I mean, just from it's just, for those of those people, like Carrie said, who've never done this before, who don't have a clue, it's just a nice sort of, hey, this is where I want to be. And then, you know, say I'm somebody who's relatively new. I want to do some easy wins. I want to build my community capacity. I'm going to start a policy. I'm going to do some planning in year 1 for a policy. I'm going to do take-backs. I'm going to do prescriber trainings, blah, 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 you know, because I have these certain intervening variables. As long as there's a good understanding of the connection between what my problem is and why it's a problem in my community and what I've selected, and then good information as to how I can start working on those things, that to me is the most critical thing that should happen in year 1. Now, obviously, some people are going to go above and beyond that, but to me, it's not as useful to have a 3-year plan that's convoluted, that quite frankly is made up. because because most people don't understand and can't plan for those emergencies or weird situations or people leaving or whatever, and being held to a 3-year plan. Not that it's not a 3-year plan, but this is the step 1 of a multi-year plan. And then what should happen after the year 1, whoever is in your role takes a look at all these action plans and says, okay, where we're at, what happened, did you get further, are you behind, why did that occur, how can we help you TTA, how can we help you state, blah, 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 blah. You know, let's move you forward. Are there some things that in 2017 you thought were a concern that are no longer a concern in 2017 or pardon me, 18 or 19, and tell me why? Like, it's a cyclical process in my mind. And I think if you say 3 years, that really locks people in and it doesn't allow them flexibility. And I'm not saying you give everybody flexibility, like, oh, I'm going to change my strategies every year, I'm going to change my needs assessment every year. I mean, that's not the case. But I think, go ahead, I'm just talking at this point.
I was going to say they should be looking at it each year to see if they have any updates, but not significantly redoing it.
I think that they will, but I don't think that at this point, I think you're going to have to do a really clear review of it in year 1 to see if they're even on the right track.
Yes.
I agree. I just know that I'm a bad planner for 3 years.
This is a brand spanking.
At a basic minimum, I can't tell you where I'm going to be in 3 years, and I certainly can't tell you how I'm going to get there. I can tell you in a year, maybe.
Listen, a year ago, I wouldn't have planned on a child. Look at this mess.
Right? Right? I mean, that's what I'm just saying at a basic. I mean, in theory, it's a great thing, right? If we were in year 6 and we had providers who are used to this, I think that's a reasonable expectation. People who understand how to do the work, they've done it before, they know their communities. That's a reasonable expectation. I don't think we're here yet. We could be. We can get there, but not in the first year or 2, in my opinion.
Yeah.
I'm not saying a 3-year plan isn't bad, by the way. I want to clarify. I'm just saying I don't think we can project out a 3-year plan at this point, given that we have to do it by May.
No, but I think it's a good place to get them to, especially if we introduce kind of the plan as far as what it might look like in some form in the January meeting. We talk to them about some first steps, and then we begin to walk them through some action steps that are feasible for the different environmental strategies. Then I think that they'll be able to see a longer-term vision. The other thing, Melinda, I think that you'll be able to help them in clarifying is the fact that you're going to be totally fine that there's a lot of planning in year 1 for audit purposes, or a lot of capacity building in year 1. Like, they need to hear that from the state, that they won't be penalized for not, quote unquote, getting outcomes in year 1, but building their capacity in their community and doing some other things like that.
Mhm. Yeah. And by year 1, do you mean this year or next year, fiscal year?
Next year, when they started their plan, when they're rolling out these new strategies that they're unaccustomed to.
Well, I mean, that's an interesting point, and I don't want to go here too long, but let's talk about policy work, right? So let's say I have my intervening variables. Let's say I know what I want to do, but let's say I don't have the support. So maybe that's a pre-plan. I don't want to categorize it in a way that's awkward, but it's like a pre-planning thing. Let's say I'm not even a really strong member of my coalition that works on this. So maybe some of the stuff that's prescriptive is, if you want to start working towards this, these are the things you have to have in place. If you don't have these things in place, like you're not an active member in a coalition that addresses whatever this is, then you need to build your, build your membership, build your participation, and maybe that's your year 1, and so you count that in community-based processes, right? And then, so then year 2, it becomes, okay, now I'm on my coalition, now I've had some work done, now we're going to start reaching out to law enforcement and getting them back on board now that I have establish myself and my coalition to do this work. And I mean, I think I agree with what Terry's saying in terms of there has to be some flexibility for people who've never done this, because it does take a lot of work to do some of these things, policy in general, right? Now, obviously, if there's other things you can do quickly, then you can do those quickly. But maybe if we, again, outline some of this stuff, that would be helpful. And I don't know if you put that in a work bundle or if you just say, okay, community-based process, you know, have at it. Again, it gets a little bit,
I see that's where I think there's some overall capacity pieces that they'll put in their strategy. So if you're going to do policy work, you identify some policies, and then you know one of your steps is to build the capacity of those partners, and you list that out as an action step to build capacity of those partners. How are you going to do that? You're going to meet with them. You're going to go to the coalition meeting. You're going to discuss things. So then they see some natural progression of things they've got to do in year one to get the capacity of that partner up to par.
Yeah, I'm just trying to kind of wrap my brain. I hear what you guys are saying. I'm just trying to kind of wrap my brain around how we can do this in a way that doesn't have them feel like they're having to, you know, redo it every year.
well, I mean, I would say that it's more of a building upon versus redoing. No, there's certain things that should be done in a year, no matter what, right?
Yes.
And there's other things that are ongoing and that need to be revisited. Everything needs to be revisited, but the things that are longer term, longer change, I mean, that needs to be added on. Like, and I think that's, you know, sort of the role of the TA Center is to check in, see where people are at, see where they're struggling, see where they can help, see where they're at a crossroads because they don't know what to do next. And rather than redoing necessarily, and maybe when I think it's redoing is when, or going backwards in some ways, is when there's been a staff change, or there's been an administration change, or an election, or something where, you know, things that are out of the provider's control happen, right? That to me is more of a reset. And that, I think allowing for that flexibility is helpful so that the new person or whoever doesn't feel like I have to convince Sheriff Joe to do my policy when he doesn't care about it and Sheriff Bill did. You know, I mean, you know what I'm saying? Like, I don't see it as a redo as much as I see it as a build upon or to plan for those unexpected events.
Yeah, so it's really updating.
Yeah, it's allowing for the nature of prevention to occur the way that it naturally is going to occur.
So is what we really need just a formal statement saying we recognize that you won't know all the action details for years 2 and 3, and that those will be updated as you go, and that we also recognize that you know, things happen in communities, and that there may be that create change, that make parts of details in this change, and that's fine.
Yeah. To me, that is a great statement.
I think that should be I think that's a very reasonable expectation. I would not want people to feel like whatever they write today
is gospel.
A1 is written in stone, because I don't think anything should be written in stone.
Right. And that's what that was my main fear as you talked about a 3-year plan, just based upon my own experience with a 2-year plan even.
Yeah. Yeah, I think that's perfectly fine. I think it's not just reasonable, it's what I would want them to feel and understand.
I think we just solved the world's problems.
Woohoo!
Well, and again, we will have Echo to help sort of do more real-time. We'll be able to understand where people are at in more of a real-time view versus we don't have anything now. So what feels like impossible or very difficult may look different in a year, hopefully.
And they don't realistically have to put in interventions in Echo that they're not going to be working on, you know, in the next 6 months or so.
Well, and I think we don't tell them that. I think we just say if you have interventions that you find you're going to use later, you can add them. But having them think about their interventions in advance, I think will be less likely to confuse them. But then knowing they're not tied to not adding, like they're not, knowing that they can add is going to be helpful. Does that make sense? Like, and I think that is the way you go with that, as opposed to telling them they can wait 6 months to put something in, because that will be taken literally. So I think just giving.
But realistically, if they know they're not going to be doing something until year 3 or even year 2 in their plan, there's really not a point in them entering that intervention right now.
I don't think they would. I think that as long as they know they can add interventions as they get to them or need them for their plan to see the work done in their communities, then that'll be enough. I feel like they're probably not going to do, Melinda, as much as I would like to have high hopes in these people, I don't think we have like overachievers that are going to put in like 3 years worth of work. They're going to wait.
Yeah. Yes, I agree. Okay, so I think we're all in agreement that they need clear messages, that we don't need to have details for interventions that are going to happen significantly later right now, that you'll have opportunities to update. We recognize that things happen in communities that may end up leading to changes. And so they are going to develop a plan that shows, you know, what intervening variables and contributing factors they're addressing with which interventions. When they enter those in ECHO, they'll have action steps. Now, that last part I winged on my own. Does that sound right?
Yes, as long as we articulate which interventions require action steps, and because not all interventions will require action steps, correct? Sorry, CSAP 6 strategies, not from the plan. Sorry.
Yeah.
Never mind. Go ahead.
You know, the only time where they might not require action steps is that.
You guys, I'm going to have to, something's wrong with WebEx, and I need to shut this off because their webinar is messed up.
Okay.
So I'm really sorry.
To shut down too, that's fine. I think we're done using that piece.
Okay. All right. It's going to end the event in the phone.